So welcome back. Today we're going to speak about the frontal bone and the occipital. So the frontal bone, as you know, is a single bone that conforms the view and the superior and anterior view of the skull. We mentioned that in the previous lesson of the anterior view of the skull, and you can see a few landmarks here, which we're going to mention, are, for example, in the midline, in the anterior midline between the both orbits, just right in this area. Because this is a digital model, again, it will be a bit difficult to see. But if you take um, plastic model based on a real skull, or even a real skull, like in this image, you will see a small depression in this anterior midline, which is called the glabella. And I consider this an important also landmark of the frontal bone. It's concave. The whole frontal bone in its anterior view is convex, but the glabella is a depression, so it will be concave. And it's located, as I said, in the anterior midline of the frontal bone. We mentioned this as well, the supraorbital margins of both sides, on the right, on the left, of the orbits. Supra is above, orbital uh, above the orbits, and margin is the line that delimitates the area in these both cases. At the same time, we mentioned also during the lesson of the anterior view that there are two foramens, or openings or holes, which are called the supraorbital foramen. You have one on each side, and as we said, this provides the passage for the nerves to the forehead. Another important aspect of this frontal bone is that in its anterior conformation, you will see that provides the roof of the orbit. All right, you can see here how in both sides the frontal bone, being a single bone, provides the roof of the orbits, where the as a socket for the eyeballs, right? But at the same time, because it conforms the roof superiorly, in the posterior side and below, it would conform the floor of the cranial cavity. All right, or even we can say it conforms part of the anterior cranial fossa. So basically, those are the main things of the frontal bone. Just remember also that there's a zygomatic process of the frontal bone which joins to the zygomatic bone itself through this suture, which is called the frontozygomatic suture. All right, so we have that in both sides, here and here, and this joins to the zygomatic bone. Then, as we saw or we studied in the previous video, we will have the temporal process of the zygomatic bone, which will join again to the temporal process of the to the zygomatic process of the temporal bone. All right. So just bear that in mind. The zygomatic process of the frontal bone, the supraorbital margins, the supraorbital foramens, the glabella, which will be in this area, and the conformation of the roof of the orbits, but at the same time and posteriorly the floor of the cranial cavity. Just as a quick review, I'm sure you all must know by now the name of the suture, which joins the paired parietal bones to the frontal bone. It's called the coronal suture, all right, and that joins the pairs of parietal bones. Don't get confused with this one, because this will be the suture that joins both parietal bones, and that's called the sagittal suture. All right. Now let's speak about the occipital bone. We've seen most of this, the occipital bone, in the lesson of the posterior view of the skull, but let's review, because there are other landmarks which I haven't commented. You know that is limited mostly by a lambdoid suture, all right, that joins the two parietal bones posteriorly. We spoke about the protuberance, which was in this area, and we said we couldn't see it here because of a digital model, but we could see it in a real skull, or in a plastic a skull that's based on real skull, is the external occipital protuberance. And this serves as the joint, or the provides, the attachment point of the ligaments of the neck. A very important area of the occipital bone. Running at this level and towards the mastoid process, on each side is the superior nuchal line, which we commented as well, which serves in this case as the attachment point of the muscles of the neck. And inferiorly, below the protuberance, the external occipital protuberance, will find the inferior nuchal line, which will be in this area. All right. So that's one important point of the occipital. But I want to show you, if we isolate this occipital bone and we just toss it around to see the inferior view, this foramen, I think you probably must know about by now the name of this hole, this big hole, and it's called, and if you're not, I'll tell you, it's the foramen magnum. Okay, foramen magnum, big hole, or huge hole, because it is, in comparison with other foramens around the skull and even on the body. But it's quite significant, not only because of the size of the hole, but also because of the importance of this foramen magnum. And why is it important? Because this is where all the nerves, it provides the passage of the nerves towards the spinal cord, to the vertebral column, as we saw before. Okay, so very, very important area. And on both sides, you can see here, both sides of the foramen magnum, is what we call the occipital condyle. And the occipital condyle, what it's going to do is join with the C1, or the first cervical vertebrae, is the point of join of the skull and the vertebral column, and that's where the skull is going to get fixed to in the vertebral column. Thanks to these condyles, it will join directly to the first cervical vertebrae, C1 or atlas. All right, we can put that back in the standard mode, and you can see a little bit better how these condyles join with the C1 or atlas or first cervical vertebrae.